Hi, I'm Natalie from ATMS and welcome to our Practitioner Spotlight. Today I'm joined by Amy Tyler. Hey Amy, how are you?
Hi Natalie, I'm well, thank you. How are you?
Oh, good, thank you. And thank you for joining us today to give us a brief overview of what you do. So let us know, who are you, where are you located, and what is your modality?
So I'm located in the north of Sydney in Waitara, and I'm a remedial massage therapist, and I've been practicing for about 22 years now.
Fantastic. So 22 years. So that's a long time to practice massage therapy. Have you had to change and adapt and, maybe have an area of focus or something that you really love to do in clinic?
Absolutely. So over the years, I've done a lot of different studies, and I've actually ended up specialising in oncology massage, scar massage, and lymphatic drainage. And the three of those really combine very nicely together for my cancer patients and are a little bit more gentle on the body than the sports massage, which I was into 20-something years ago.
And I guess that's good, saving your own body and hands and everything as well, isn't it?
Absolutely, because I love my career and I see it as my only career. So I don't plan on burning out.
Oh, that's fantastic. May I ask, how did you get into massage therapy to start with?
Interestingly, I thought I wanted to be a physio in high school, and I did year 10 work experience in a hospital physio, and we were in ICU and the patients were mostly unconscious. And I'm a bit of a talker, so that probably wasn't going to work out for me. And it was probably the physio environment in the hospital that turned me off being a physio. And I love the hands-on work. So my parents said to me, well, what about massage instead of physio? And that's what I went to do straight out of high school. And it was exactly what I wanted. So,
that's perfect. It was meant to be your profession, your lifelong profession.
Absolutely.
So tell me, if someone's wanting to come and see you for oncology and scar massage, what could they expect from a treatment from you?
Okay, so quite different depending on where they are in treatment. If they have just been newly diagnosed and they are in the treatment phase, then really, first of all, full medical history, seeing where they are in treatment, how it's affecting them. And then it's more a gentle approach to massage, and it's about shifting that body from a state of stress to a state of calm, because that's where essentially our body does its best healing, is when we're in that relaxed kind of state of calm. If they're post-treatment, then it could be more a rehab style treatment. And that's where some of that scar work comes in, trying to help soften the scar tissue, make it more pliable and less painful, and giving them back some range of motion in areas where that scar is restrictive. So,
do you use any tools for the scar treatments at all?
Mostly my hands. I do have some myofascial cupping training, so I do throw in a little bit of that as well for the scar and radiated tissue areas. Just have to be very careful because that tissue is so fragile. So certainly adapting some of those skills that I've learned just to be appropriate for people who have been through that treatment. But yeah, that's about the only other thing I add into my treatment other than my hands.
Your passion for what you do definitely shows, and definitely if someone's wanting to come and see you, you said you're on the North Shore of Sydney, and you've also got Instagram, Facebook, please let us know.
Yes, so my clinic in Facebook would be Amy Tyler Therapeutic Massage. On Instagram, it's actually oncology_scar_massage. And my clinic is in Waitara, and I'm also 1 day a week at cancer support at the Sydney Adventist Hospital. And then I actually also teach oncology massage. So I've got a second Instagram and Facebook, which is the Institute of Oncology Massage.
Oh, fantastic. And thank you so much for sharing your passion and your love for what you do in oncology and massage. Thank you so much, Amy.
My pleasure. Thanks, Nat.